Hi, good evening, everyone. I am Dr. Aruna Kalra. I'm Director, Ops and Gynae Department at CK Birla Hospital, and I've been practicing obstetrics and gynae for more than 25 years. I've expertised myself in vaginal birth after cesarean, minimally invasive or laparoscopic surgeries, and many more gynae and obstetric procedures. So I've been in Gurgaon since more than now 25 years. And today we are going to discuss about breastfeeding, like how it is helpful for mother as well as baby, how it is helpful for mother to reduce weight while she is breastfeeding. And first, I would So let's start about breastfeeding. We know that we are celebrating breastfeeding year after year, but still there are many myths associated or around breastfeeding. And first thing, as Indian, I would say that as soon as we think about breastfeeding, we think about lots of desi ghee and dry fruits and double or triple amount of meals, food, which a mother should take to increase breast milk supply or to improve the quality of breast milk. We have already gained 11 to 13 kgs or sometimes more than 20 kg weight during pregnancy. And we need to shed that weight. But because we are breastfeeding, and as our elders suggest that during breastfeeding, we should be taking extra calories and much ghee or sugar or those laddus which we prepare or which they prepare for us. It is really difficult to lose weight. Rather, we gain more weight what we have gained in pregnancy. So what we have gained in pregnancy, around 6 to 8 kgs we lose immediately post-delivery. But I think 10 to 15 will gain in another 3 to 6 months because we have been eating much, much more what we were eating during pregnancy. So what we should be doing, which should not affect our breast milk supply, quality of breast milk, and still make us healthy and fit with respect to our body mass index or obesity, and otherwise a fit mother, a yummy mummy. I should be discussing or telling you what are the best dietary modifications or what are the exercises you should be doing during breastfeeding. But it would be rather good that if we have an interactive session where you are asking me questions, whether you can have this kind of exercise or whether it's advisable to take this particular type of food or not. So I would request BabyChakra to please ask questions which are important and would lead to discussion. What are the myths around breastfeeding foods or breastfeeding exercises and all those things. So as I can see a few questions here. Along with breastfeeding, what other things will help me speed up my weight loss after pregnancy? So as we know that breastfeeding, it extracts amount of fat, extra amount of fat from your body, and it leads to shaping up of mother. So the more you breastfeed, and it is demand feeding, as baby is crying or if baby needs after every 2 hours, you have to give after every 2 hours. And if baby needs after every 15 minutes, you have to provide breast milk after every 15 minutes. And if you are giving exclusive breastfeeding to your baby, you would start that fat would start melting. It would start, and your body would start shaping itself. Along with breastfeeding, what else you can do? So one thing is you should modify your diet. So what our elders believe is that eating lots of cereals like chapati or other kind of cereals, we should be having loaded, or everything should be loaded with ghee, butter, or sugar, like jaggery or sugary laddus or panjiri. But we should understand that ghee has only one nutritional value, which is calcium in it. We are giving you enough calcium in the form of supplements, and you can have double toned milk instead of whole cream milk. So if you substitute whole cream milk with double toned milk, you would get calcium, enough calcium, and calcium supplements you are already taking. You can substitute ghee with that. So what else you can do other than breastfeeding to reduce your weight? You have to modify your diet. You have to stop sugary things. You have to stop dessert. You can have lots of fruits and vegetables which are water filled, which would keep you hydrated. And you can have lots of dry fruits like almonds, walnut, coconut, pumpkin seeds, but it should not be roasted. So fried item you should stop. So modification in diet is very, very important. Next question is, how should I plan my diet when breastfeeding to support my weight loss and not hamper my breast milk supply? So as I was telling this, so this is extension of this answer is extension of previous discussion. Then what are the modification which we can do? So instead of having roti, chapati, rice, we can substitute or replace it with dalia, porridge, oats, and quinoa. One. Second, no sugar, no jaggery, no honey, or nothing sweet. If you have already gained quite an amount of weight in your pregnancy and you would want to reduce, you should stop sugar or dessert altogether. But your craving for sugar, you can satisfy yourself with fruits. So lots of fruits which are water filled. You can have every kind of fruit during breastfeeding. Again, you should not be having ghee, butter, cheese, whole milk. You should be having skimmed milk. You should be having, instead of whole fat cheese, you should be having tofu. So everything like lean meat you can have. You should be having eggs, chicken, but lean meat. And fried items, anything which is rich in fat or sugar, you should avoid. You should be having very frequent meals and small meals instead of having 3 or 4 major meals. You should substitute your solid meals with soups, shakes, buttermilk, and all those liquid, power-packed liquid diet. Will my breast regain its shape back after breastfeeding, and how? So another question is, if I breastfeed my baby and if I breastfeed exclusively for 6 months or sometimes for a year or two, whether my breast would be same shape or size as it was before? So I should say that, okay, not immediately, because babies suck all the fat out from your breast, so it will be saggy. It will take some time to regain its shape, to regain its fat, and we should be starting good amount of upper body exercises and Kegels exercises and core strengthening exercises as soon as we cross 6 weeks post vaginal birth and 3 months post cesarean. But after cesarean, gym should only be started after 6 months. But you can start brisk exercises, swimming, a walk, everything 3 months after cesarean. And after normal vaginal delivery, you can start exercising after 6 weeks. I have low breast milk supply. Will I lose weight if I breastfeed? So milk supply, one thing, would increase with baby suckling effort. So if baby suckles frequently and it's not on top feed, or any other formula feed or solid feed, you would have frequent suckling sessions with baby, and suckling actually stimulates brain to secrete prolactin hormone, and that is the hormone which helps in quantity of milk. So quantity of milk can only be increased with frequent suckling of breast on breast by the baby. One. Second thing is size of breast does not matter when it comes to quantity or quality of milk. Second and third thing is, even if you have less milk supply, which you feel it is less, yes, you would reduce weight, but if you are giving formula feed and any other top feed to baby, your weight reduction would slow down, because baby is having because you are having less suckling session with baby, and that's why your weight loss would be a little slower than somebody who is having exclusive breastfeeding. So quantity of milk definitely does not matter, but frequency of suckling matters. And if you are frequently giving formula feed, it would slow down your weight reduction while you are breastfeeding. Will breastfeeding expression also help weight loss, or it only helps if I feed my baby directly? One thing I would like to say, that if you feed the baby directly, would help. One, yes, it would hasten your weight loss, and it would increase bonding with your baby. Psychological bonding is more, and immunity also increases. Baby's immunity also increases if you let the baby suckle on your breast. But if for some reason your baby is not able to suckle on your breast, or you're not able to feed your baby directly, and if you are trying to pump it out, mostly, yes, we are able to pump out efficiently, but still, if that breastfeeding can extract a much amount of breast milk, then expressing the breast milk with any of breast pump. But if you are doing frequently and you are able to satisfy your baby's need, and baby is being 6 to 7 times with your breast milk, even if you're pumping and giving, it is enough for the baby, and it will help you reduce weight, and it will help your baby to bond with you and have good immunity with your breast milk. So this is, and somebody would ask me that in our Indian households, we are asked to give or eat lots of panjiri and 7 or 8 kgs or more, sometimes 10 kgs of ghee. So we have modified panjiri here, or laddus, what we make, and we know that in Ayurveda, all these ingredients which we put in our homemade panjiri or laddu are very important, and they are galactogog. Galactogog means which increases breast milk supply. And we say that, okay, why not we modify this laddu making process? Ingredients are good. These are makhana, dry fruits, kamarkas, gond, jeera, ajwain, and methi dana, and all those things. So why not just fry it or roast it without ghee, grind it and mix it with a little amount of jaggery or a little coarse wheat flour, and make it in the form of panjiri, because all these ingredients are galactogog, jeera and methi dana specifically, which are very, very important. And dry fruits give us polyunsaturated fatty acids, which are very important for baby as well as for you. So we can always make a modified panjiri or laddu without adding ghee to it, and it will help us. One, it will help it will increase quality of breast milk, and it would definitely give your bones some strength, your skin and your muscles would need all these polyunsaturated fatty acids and calcium and all these ingredients which are there. They are really helpful in postpartum recovery of any mother who has been to 9 months pregnancy, labor, or even after cesarean, you can have that. So this is very important, and I tell every pregnant or delivered mother of my patient that please have panjiri. Do not ignore the ingredients. So I would like other questions to come. If you have some more questions, you can ask here, and else I'll continue. Okay, so last thing I would want to tell, which many mothers would ask me, is what kind of exercise we can do. So after, see, 40 days period is very, very important for you to take rest, because your muscles are exhausted after labor or after 9 months of pregnancy. You need to, your muscles and your bones need to regain the strength. You need to have a routine with your baby. Your sleeping pattern is disturbed, you are breastfeeding your baby 24/7, you are not able to sleep properly, your stitches are painful, whether it's cesarean or episiotomy, stitches are painful. So you need to make a routine or set a new routine with your baby. Baby is in jet lag, baby is up all night, and you are tired breastfeeding during the night, and you are not able to sleep during the day. So you have to make a new discipline, new routine, and it would take few days. Sometimes it takes a month or 6 weeks. Baby would start holding its neck by 3 months, and you'll be much, much more comfortable feeding your baby. And by that time, baby would be having a breastfeeding routine. So after that, after 6 weeks period, when once you are totally healthy, in terms of your hemoglobin is now up, and your calcium is, you're taking regular supplements of calcium and vitamin D, you can start thinking that whether I should start some exercising or not. Yoga being the best exercise. If you do yoga, it's good. If your body is already tuned to do yoga, swimming is very good exercise. It strengthens your core muscles, and it strengthens every kind of muscle, thigh muscles, abdominal muscles, and it reshapes your body. You can start brisk walking, and if you feel that you have time and you have strength and stamina, and you were doing jogging before, you can start that as well. After normal vaginal delivery, you can start gym also. And I would believe personally that you should maintain a discipline. You give yourself some me time. Other than breastfeeding and all the time with baby, you should be having your me time for your mental as well as physical health. And after cesarean, I would say that you should start a regular brisk walk with your belt on or your tummy to support your stitches after 3 months. Gym you can start after 6 months. And but you please have your modification in your diet, so that you should not gain more weight. If you're not able to lose, at least do not gain. It would only take 6 months time to reduce or lose your weight completely. Just 2 to 4 kg sometimes is left, which is a little resistant weight, which would take some time to go away. But otherwise, you start losing weight after, say, 6 weeks post delivery, 500 to 1 kg every month. And by 6 months, you're back to your normal pre-pregnant weight. So I have a message for all the young mothers who are either pregnant or would be mother going to deliver anytime soon, that please have a healthy diet during pregnancy. It should be less in fried ghee, cheese, or bakery products. Your diet should be a power-packed fluid diet, which includes soups, shakes, coconut water, buttermilk, and less of carbohydrate. One, and post delivery also, you do not require meals or calories for 3 people. You should be having good amount of healthy balanced diet, and you should not deprive yourself of healthy balanced diet. You should not definitely diet, but modify your diet. Instead of having simple carbohydrate, have complex carbohydrates. Instead of having ghee, sugar, butter, you should have polyunsaturated dry fruits, which are which provide you fat, but a healthy fat. So all the mothers, please keep yourself fit and be a yummy mummy, but a happy yummy mummy. Thank you, BabyChakra, and we are here, and we will be always here to answer any other questions if you have. And I'm here at CP Birla Hospital for any other queries or any other doubts if you have regarding breastfeeding or postpartum blues, postpartum depression, or how to lose weight post-delivery. Thank you, everyone. Take care.